Hello and welcome to Mini Medicos. Today we will learn about acute appendicitis, its causes, symptoms, and treatment options. Now, what is vermiform appendix? It is a vestigial organ. Its normal length is about 2 to 20 centimeter. Its blood supply is appendicular artery, which is a branch of ileocholic artery. Appendicular artery is an end artery, so appendix undergo gangrenous changes very easily when this artery is compromised. Next, we will study about various positions of appendix. Appendix have different positions in different individuals. Various positions of appendix are given in this image. Most common position is retrocecal and least common position is post-ileal. Most dangerous position is pelvic because pelvic appendicitis present with unusual symptoms like hematuria or diarrhea and delay the diagnosis. Acute appendicitis. It is the most common surgical emergency worldwide. It usually presents in second decade of life. Causes of acute appendicitis. It occurs due to obstruction of lumen of appendix. Now, luminal obstruction can occur due to the following reasons, where most common cause is fecolith. Other causes can be carcinoid tumor of appendix, worm infestation like ascariasis, or sometimes fruit seeds. Etiopathogenesis of appendix. Once the luminal obstruction occurs, secretions cause our distension of appendix, which then cause blood supply compromise. Once the blood supply is compromised, mucosal sloughing occurs, which cause gangrenous changes and then perforation. Most common site of perforation is just distal to the obstruction on anti-mesenteric border. Most common organism isolated is Bacteroides fragalis more than E. coli. Clinical features: patient present with pain that starts first in periumbilical region and then shift to right iliac fossa. Other symptoms are anorexia, nausea, and vomiting. Patients have signs like tenderness in right iliac fossa, rebound tenderness, and elevation of temperature. Alvarado score is a scoring system to diagnose acute appendicitis. We remember this score with the help of a mnemonic called mantras. Now, if the score is 9 to 10, we are certain that diagnosis is acute appendicitis. If the score is 7 to 8, there is highly likelihood of diagnosis. 5 to 6 score is equivocal. 1 to 4 score, result is negative. In case of equivocal score, we have to do CCT abdomen to confirm the diagnosis. Presentation: patient can present to us with either acute appendicitis or appendicular lump or appendicular perforation or chronic appendicitis. Treatment for all of them is different. No, diagnosis. Investigation of choice in children is ultrasonography, where investigation of choice in adult is clinical diagnosis. Gold standard in both of them is CCT abdomen. Named signs in acute appendicitis. Dumphy sign. It is the pain in right iliac fossa on coughing. Rovsing sign. It is pain perceived by patient in right iliac fossa on giving pressure to left iliac fossa. Swas sign. Hyperextension at a right hip joint causes pain in right iliac fossa. It is seen in retrocecal appendicitis. Other signs are obturator sign. Pain on internal rotation of right thigh on hip joint. It is positive in pelvic appendicitis. Around sign is pain in right iliac fossa on giving pressure in epigastrium. Treatment: it depends upon how the patient present to us. Now, if the patient present to us with acute appendicitis, emergency appendectomy is done in the same sitting. If the patient present to us with appendicular lump, we manage the patient conservatively with Ochsner-Sharin regime. Now, what is Ochsner-Sharin regime? We remember it with the mnemonic mark IV man, where mark means we mark the size of swelling. IV means IV fluids are to be given to the patient. M means vitals need to be monitored, like temperature, BP, respiratory rate, pulse rate. A means antibiotics and analgesics are given to the patient. N means nasogastric aspiration is to be done. Components of appendicular lump are appendix, ileum, cecum, and omentum. If the condition of patient on conservative management starts improving within 24 to 48 hours, we continue the conservative management. Interval appendectomy is done after 4 to 6 weeks in case of recurrent appendicitis. If the symptoms of patient doesn't improve after 24 to 48 hours, surgery is to be done. If patient present to us with appendicular perforation, emergency surgery is done. Thanks for watching this video. Please like and subscribe Mini Medicos for more medical videos.